Hey students, so this is still continuation on introduction on the foundational ethical concepts and historical perspectives of ethics in nursing. The question here that we always raise in this first topic is, why do we need to study ethics? Now, why do we need to study ethics? Some would say that ethics is the answer to what is right. Ethics is the answer to what is good. But guys, that is not how simple it is. That is not how simple it is. Oftentimes in the clinical setting, when you encounter situations, the situations is not purely good or purely bad. You need to weigh on the situation whether it will be beneficial to your patient or will it be not. Okay, so it's not purely good, it's not purely bad. So you need to have a basis for your decision making. Okay, that's why we are learning your ethics. Now, if you would look at this, we encounter ethical dilemmas. Okay, we encounter ethical dilemmas. When I encounter ethical dilemmas, it's a situation. When I say dilemma, students, it's a situation wherein you could not easily choose between right or wrong. Okay, it's a situation wherein you could not easily choose between what is right or what is wrong. So it means that you need to decide, you need facts, you need basis for you to determine what would be the best move that will be done to your patient. Now, this means lack, okay, plus your ethical dilemma usually results from the lack of good quality patient health professional communication about diagnosis and prognosis. Now, you can highlight there the word communication. Why? What do you mean by that? Class, it says here that the dilemma often arises from the good quality patient and health professional communication. When I say class health professional, that could actually refer to us as nurses, that could actually refer to physicians, and that could actually refer to other healthcare professionals. Now, oftentimes the problem is this, the communication. Picture, for example, a patient with cancer. The common situation is this. A patient was newly diagnosed with cancer. Let's say, for example, the patient is 80-year-old female. Okay? The patient was just diagnosed with cancer stage 4. I think you don't have the concepts yet in cancer, but when I say class stage 4, that would usually refer to the end stage of cancer. No? So you have stage 1, stage 2, up to 4. Now, oftentimes in the Filipino family setting, they would say, hey, please do not tell my mother that she has cancer. Okay? Because if she will know about cancer, she might feel sad. Anyway, she's 80 years old. She will die. Sometimes that's the mentality that happens in our society, no, in our community. Because the family, if you would come to understand them, they would also want to protect their own family member. But as a nurse, you might be thinking, so what will happen to my patient? Okay? What will happen to my patient? What will be the next thing that will be done to my patient if my patient does not know that he has cancer? So basically the question there of, will I tell my patient the truth? Or will we follow the family members and hide it from the patient? Okay, that's an ethical question. That's an ethical dilemma. And now, your ethical dilemma is actually traversing from neonatal care to care of the old adult. Okay? When I say neonatal care, it's from the care of the babies up to the care of your old adults or your lolas and lolos. So what are the ethical dilemma there? For example, if you're dealing with neonatal care, no, one concern there that you have is that how would we know if the patient is in pain or not? Look at the babies. The baby would just cry, but crying for babies is several reasons. Okay, has several reasons. Since you are entertaining maternal and child nursing now, so you know that if the baby will cry upon birth, will we be happy or will be sad? If you hear the baby cry by the time it gets out of the vaginal canal, is that a good indication or bad? Ha guys?
Good, sir.
Okay, that's a good indication because it actually indicates that yay, the lungs is expanding, the lungs, the air is is having entry to the lungs. But if the baby is crying, your baby crying naman is already a late sign of hunger. It could be that the baby is in pain. So as nurses, you are in a dilemma. What should be done to this baby, okay, for us to address the concern of the babies? And then the same thing for old people. Okay, oftentimes we decide for the care of our lola and lolo without even asking them. Kung ano ba talaga ang gusto nila, no? So oftentimes, for example, we would say, let's bring Lola to the hospital because Lola needs the best care, etc. Whereas the Lola would just want to lie down in peace at home. So those are the things that you need to consider when you are deciding for the care of your patient. So those are ethical dilemmas, no? Oftentimes as a nurse, you will say, no, bring Lola to hospital. The hospital can help her. But then the Lola would say, no, I would want to be healed here at home. So as nurse, you need to present options. Would you want home care for your patient? Would you want a physician to visit your patient at home? What will be the remedies that you will be doing to this patient? As you can notice, I could not give you yet a correct answer for that because we will know that in the theories of ethics. Now, another problem that nurses encounter is unsupportive organizational environment. That's the reality. There are unsupportive organizational environment. Why? One example, low staffing levels. If you would look at the ideal nurse to patient ratio, my dear students, it's 1:5 to 6. What do we mean by that? One nurse, guys, should be taking care of 6 patients at most. One nurse should be taking care of 6 patients at most. This is in the ward, ha? This is in the ward. When I say ward, there are several patients there being taken care of. So class, what happens in reality? In reality, you would notice that one nurse would take care of 10 patients. One nurse would even take care of 20 patients. And here comes the problem. For example, you had a patient whom your patient had delayed medications. You will know later on in pharmacology that you would want really to give the medications on time. Gusto natin medications is on time. But then I am handling 20 patients. What do you think, guys? Can you give all the medications at 8 a.m. if you are handling 20 patients? So the reality is that, of course not, no? Of course not, okay? Because class, that would lead to delay of the care that you are administering to your patient. So at times that happens. Second, overload of work. What do you mean by overload of work? Other than being a nurse, guys, you also have your additional roles. Okay, you also have your additional roles. What are examples of these additional roles? For example, you need to attend training. For example, you need to check the e-cart. Okay? For example, there are some administrative roles that are being assigned to you. And for that reason, the tendency is that the nurses would be overloaded for work. Once nurses, guys, becomes overloaded for work, one effect that they may have is that it results to stress. If there will be severe stress, what do you call the term, guys? Leading from severe stress, something that starts with letter B. What do you call the term?
Burnt out, sir.
Very good. Okay? You will have a tendency to become burnt out. Now, on the aspect of ethics, the tendency is that if nurses are burnt out, my dear students, okay, the tendency is that you are not making good decisions. Okay, you are not making good decisions if you are burnt out. Okay, that's one thing that happens. Then you have hierarchical interactions that do not promote the dignity of nurses. What do we mean by hierarchical interactions? For example, I'm a staff nurse. Okay, if I am a staff nurse here, for example, this is me as a staff nurse. Sorry. For example, this is me. Where's my pen? This is me, for example, as a staff nurse. I have a problem. I would want to refer. Before I can go to somebody class in the HR, okay, let's say, for example, I would go to the HR department. The HR department class is the one that is in charge of employee engagement, employee satisfaction, employee happiness, everything related to employees. HR kasi is human resource. Now, I'm a staff nurse. Before I can go to HR, I need to pass through my team leader. After my team leader, I need to go to the head nurse. Before I would go to the chief nurse, I need to go to the supervisor before I will go to the chief nurse, and then that may be the time that I will be connected to the HR. So, what's the tendency of the nurses? Sometimes they will say, never mind my problem. I will just address my problem on my own since there are a lot of people that I need to pass through before I could even get help. Okay? That's what we meant by hierarchical interactions. In fact, class, in your leadership and management, we call this type of organization as bureaucratic. Okay, okay. Pardon my spelling. So it's bureaucratic. Let me check first. Class, we call that type of organization as bureaucratic, meaning there's a lot of ladder that you need to pass through before you can get to somebody on the top that could possibly help you. Okay, yeah, I'm on the right track. So bureaucratic organization. Okay, so these are some of the problems that we encounter in our setting. And mind you, students, okay, the low staffing levels no is both good news and bad news for you. I presented it to you earlier as a problem, but on your end, it could be a good news because by the time that you will graduate, jobs are actually waiting at you already. Okay, for example, my students who have just taken the board examinations, my students, I mean, who are about to take the board examinations, the hospitals are already tapping on them. Okay, the hospitals are already trying to reach them because of the shortage of the nurses in the hospital setting. Now, other situations, there is violation of the rights, safety, or well-being of the patient or relatives. Okay, so that could possibly happen. So class, take note that as a nurse, whenever the rights of your patient, the safety of your patient, the well-being of your patient, once class they are compromised, you need to prioritize your patient because as a nurse, you are considered to be a patient advocate. You are considered to be a patient advocate. When I say class patient advocate, you determine what's best for your patient and you promote that. You do that because that is what is best for your patient. Okay? Now, how about those who threaten the nurse's dignity and professionalism? Class, no, I'm not so sure if this is still happening. But for example, in the past, there will be instances that there are, for example, malicious touch in the operating room from another healthcare professional. For example, you're doing OR and then another healthcare professional will touch your private parts. Now, what would you do as a nurse? Will you tolerate it or will you report it right away? Will you tolerate it or will you report it right away? What do you think is the best thing that you will be doing?
We will report it, sir.
Okay, so class, right away, report it. Okay, now, if I'm talking about any type of abuse, we practice zero tolerance. So class, whenever your dignity is threatened, whenever professionalism is threatened, class, you practice what we call zero tolerance. In other words, class, once they did it, call their attention. How would you call their attention? You can tell them, sir, I don't want what you did. Don't do that again. Okay? Sir, I noticed that you touched my butt. I don't want that to happen. You right away tell them. Why? If you will be tolerating them, you are giving them the idea na, okay. Okay lang naman sa kanya that I will be doing it. Okay, I can do this because she did not do anything about it. Okay, you're tolerating them. In other words, you're giving them the idea that it's okay with you. Or you're also giving them the idea that you are afraid of reporting them. Okay, you are afraid of reporting them. So they will keep on doing it. That's why we always say zero tolerance when it comes to your threat to dignity and professionalism. Next, inadequate attention to the moral conflict of nurses' values. So oftentimes, class, no, a very good example for this perhaps is your abortion. Okay, let's take for example that if you can say traditional, okay, if traditional is the right term, let's say for example if I'm a traditional Catholic, and then I would say I don't want abortion, I do not support abortion. I don't know. Let's put it in the context of family planning. I'm so sorry. Let's say, for example, quote unquote, you're a traditional Catholic, and then you do not support family planning. And then you do not support, for example, specifically your BTL. What's BTL? What's an idea of what is BTL as a procedure? Who has an idea of what is BTL as a procedure, guys? Your mothers might have undergone it. Your titas might have undergone it. Yes, this is for ladies. Class, it is your
Ligation,
bilateral.
sir.
Very good, very good. Okay, that is your bilateral tubal ligation. Okay, it's a family planning method. No? It's a family planning method. As a family planning method, it does not. It would cut your tube. That's why, class, it's referred to as tubal ligation. Because what would happen? Pardon my drawing. Allow me na lang to search for. Allow me to search for a picture na lang. Let me see. Female reproductive system. Okay, so class, if you would look at the picture there, you have the female reproductive system. Allow me if what can I move? Can you see, class, the picture on the screen or not? Oh, it's not visible on your end. Let me see so that I will be able to give you an overview rather than for you to imagine it. So class, what actually happens here is that the fallopian tube is cut. Okay, if you would look at your principles in MCN, where does the fertilization begin? Students, where does fertilization occur? Sige na guys, in what part of the female reproductive system does your fertilization occur? Anybody? Okay, it occurs in the fallopian tube. Very good. Now class, when I talk about your bilateral tubal ligation, what's actually being done is that it's cut here. Okay, it's being cut here. It could be permanent, it could be temporary. If it is temporary, class, it is being tied. No? It is being tied, as in tinatali siya. But then class, for permanent, it would be cut. Now, let's say, for example, you're a Catholic, and then, let's say, for example, you're really convicted on your belief that it is the act of God for a woman to give birth. And then you believe that bilateral tubal ligation is contrary to your belief in family planning. What do you think is best? Is it okay that you will assist the procedure? Or can you tell your head nurse that, ma'am, I'm so sorry, I could not assist in the procedure because that's contrary to my belief? What do you think can you do? Are you getting the picture, guys? So there's a procedure. The procedure is that you'll be doing bilateral tubal ligation, and you are the nurse that is supposed to assist in the procedure. But this is contrary to your own beliefs because you believe that it is the right of the woman to give birth. It is the right of God to give woman, child, whatever. Now, what do you think will you do? Is it okay that you will say, ma'am, I'm so sorry, I could not assist in the procedure? Or will you still do the procedure even if it is contrary to your belief? What do you think? Sige na, I would want to hear your ideas. What do you think is best thing for you to do in that situation? I'm
I may
waiting.
ask, sir, if I could not proceed to the procedure, sir.
Okay. So class, actually as a nurse, you have the right to refuse if it is contrary to your beliefs. Okay? Take note of that. Huh? That's why, class, if you would look at these situations, we are listing their situations that lead to ethical dilemmas. So you need to understand that as a nurse, yes, you have a responsibility to your patient. But if it is contrary to your own moral values, if it is contrary to your own beliefs, you could refuse it as long as you inform your immediate, okay? As long as you inform your immediate superior. Okay? As long as you inform your immediate superior. So you can tell your head nurse, ma'am, I'm so sorry, I could not attend to this. Ma'am, I'm so sorry, it is contrary to my religious belief. So ma'am, please, can you please assign another nurse here and I will just take care of another patient. Yes, that could be done. And then if you are a head nurse, you need to accommodate that request. That request needs to be accommodated. Next, you also have the physician-nurse power hierarchy. Plus, in the past, we are usually taught to be, quote-unquote, no, servants of the doctors. So some would say that we are just assistants to the doctors. We are just servants of the doctors. Even in our history, we are considered as slaves of the doctors. Now, at present, remember that we are already in an equal footing with the doctors. Okay? Plus, we do not also say that we are higher than the doctors. We are not that boastful, no? So we are proud of our profession, but please do not boast. Okay? Doctors are our equals. Always remember that. Physicians are our equals. Now, you might be wondering, sir, if they are our equal, why is it that there are things that needs their approval? And why is it that there are things that needs doctor's order, they say, or doctor's notes, they say? Class, because they are trained. Because they are trained to do so. Okay? So physician, being a medical doctor is another profession. Being a nurse is another profession. So it's not a worthy topic to compare these two professions. So please do not go into the argument, we are better than doctors. The doctors are lower than us. The doctors are higher than us. No. Okay, to resolve that ethical problem, you think that we are both different professions, and as different professions, we have different standards by which we could not measure one from the other. Next, there is influence of culture and insufficiency of patient care. Okay, there is culture and insufficiency of patient care. What do we mean by that? There are cultures, guys, wherein they could not receive adequate care. There are cultures naman, even if the care is available, they do not want to avail of these services. Okay? Now, for example, our patients in GIDA, okay, you have your clients in the GIDA. Okay, class, your GIDA is geographically isolated and depressed areas. Okay, so you have your geographically isolated and disadvantaged areas. So class, you have the term GIDA. Class, when I say GIDA again, geographically isolated and disadvantaged areas. Now, if you would look at their culture, here in the city, for example, or here in your locality, we might be always preaching you take medicines. After you give birth, you need to ensure that you need to take a bath. After 3 days, you need to go to the doctor. That's how we teach our patients after birth. But here comes the people in the GIDA. You know what happens to them? They will not be taking a bath for a week. They will not be taking a bath for 2 weeks because according to their beliefs, taking a bath now after delivery is not good. Taking a bath now after birth is not good. So as nurses, we oftentimes notice that the culture has a very big bearing on the care that we deliver to our patient. That's why our remedy for this one is that the care that should be rendered is individualized. Okay, the care that should be rendered is individualized. Okay, we are not stereotyping them, but students, you could not approach an ATA in the same way that you can approach a person from the city, from those of the people from ethnic groups, from those of the people in the GIDA areas. Okay, so you approach them differently. Also, sir, may special treatment? No, not the special treatment part. But guys, it would mean that if you know that these are their needs, you need to educate them. If you are dealing with people in the GIDA, for example, don't expect that by the time you will say, Mrs., you need to take a bath today. Don't expect that they will follow you right away. So you know that they might have a tendency not to obey it. So you need to follow up. You need to be persistent. You need to refer them to nurses who are working there so that they will be able to deliver the care that is needed by your patient. Then class, professional collaboration. Your professional collaboration is a big must in our profession. Okay? Now take note, you might be thinking, we are nurses, I can do things on my own. That's a very big no-no. Okay? That's a very big no-no. So you need to collaborate. When I say collaborate, you need to collaborate to physicians, you need to work with the respiratory technologist, you need to work with the pharmacist, the medical technologist, even the dietitian. Why? These are all concerns related to your patient. Okay, these are all concerns related to your patient. Now, some of the nurses would say, pag walang gamot ang pasyente, problema ko. Pag walang pagkain si patient, problem ko rin. Pag wala na namang makakain itong mga kasama ni patient, problem ko rin. Pag sira ang aircon, problem mo rin. Parang lahat na lang problema mo, di ba, as a nurse. Now, you don't think like that, no? You don't think like that. But instead, you go back to the concept of being a patient advocate. Okay, you go back to the concept of being a patient advocate. You stand in behalf of your patient. That's the definition of being an advocate, acting on behalf of the patient whenever they are unable to do so. Okay, whenever they are unable to do so. Meaning, for example, the food did not arrive at 11 a.m. and you know that dietary services supposed to deliver it at 11 a.m. for lunch. If it did not arrive, you have that initiative to call the dietary department. Say, sir, good morning. I just would like to follow up on the food of patient Juan de la Cruz. He was not able to receive N. Okay? If the medication did not arrive, sir, I would like to follow up if what happened to the medication of patient Juan de la Cruz. That's collaboration. Because as a nurse, you could not do it alone. That's the big word there. As a nurse, you could not do it alone. Okay, kindly take note of that. Now, another thing perhaps that we might encounter is that the moral distress by professional nurses, the newly graduates, and then that of the nursing students. Now, what do you mean by moral distress? When I say class moral distress, it's internationally and significantly occurring health and social care phenomenon that occurs when one knows the right thing to do. Look at the words there that are highlighted. One knows the right thing to do, but constraints make it impossible to pursue the right course of action. Again, klasa, one knows the right thing to do, but the constraints make it nearly impossible to pursue the right course of action. Anong ibig sabihin? For example, I as a nurse know that my patient needs medications. The doctor ordered medication A to patient Juan de la Cruz. Now, by the time that I gave the prescription to patient A, the prescription written by the doctor, the patient would say, nurse, I don't have the money to buy that medication. That medication is worth 1,500 and I do not have the money to do it. And then here comes you being a nurse. Sir, you really need this medication because this will help, blah, blah, blah. And then the patient would respond, nurse, I understand, but still we don't have the money to buy it. That is where class your moral distress would set in. Okay? You know what's the right thing to do. You know that your patient needs medications, but you don't have the resources. The patient does not have the resources in order to buy these medications. So it ends up to be a moral distress. So if you would be asked if what is a moral distress class, take note of those lines. One knows the right thing to do, but constraints make it nearly impossible to pursue the right course of action. Okay, kindly take note of that. Now, what are the feelings associated with moral distress? If you will have moral distress, the tendency is that there will be professional anguish, okay, over patient care decisions. Now, what are the common examples for that? So, one example is concerns for continuing life support, in which the measures are perceived not in the patient's best interest or futile care. Now, what do I mean by that? Class, I don't know if you've heard already of DNR. Class, are you familiar of the concept of DNR? Have you heard it in your fundamentals? Okay, yes. Okay, so class, what do I mean by DNR?
Do not resuscitate.
Okay, do not resuscitate. No? It means do not resuscitate. Now, class, once your patient would have the DNR, okay, pag sinabi, for example, the patient agreed to have the DNR, and then the family members all agreed to do the DNR. Class, it means that anytime the patient would arrest, okay, we call that arrest. In other words, class, once the patient would have no pulse, and once the patient is not breathing, when I say class DNR, you do not do your CPR. Okay, that's what you meant by DNR. Because in a usual situation, once your patient would undergo arrest, my dear students, you need to do right away your CPR. But once your patient has signed the DNR, that would mean do not resuscitate. CPR means cardiopulmonary resuscitation. So class, it means that if the patient will have no pulse, not breathing, no CPR already is being done to the patient. Now what happens? Sometimes the nurses would think, why did they sign the DNR order whereas the patient is still very good? Why did they sign the DNR order wherein the patient is still capable of living? Okay? That's what commonly happens plus in the hospital setting. So oftentimes the family would have hard time to decide. And then by the time plus that they decided to sign the DNR, that's actually the time that the patient's lives is still prolonged. And then plus those family members who do not sign the DNR, the tendency is that the patient's lives naman is threatened. No? So sometimes the opposite happens. No? Now, so sometimes the nurses are in anguish. Why in anguish? You are disappointed because you think that the patient does not deserve DNR, but still DNR is done to this patient. Plus, you need to take note that once an informed decision is made, okay, once an informed decision is made, you as a nurse should respect. You as a nurse should respect. That's the key word, respect. Okay? But there's a word there, informed decision. When I say class informed decision, you need to make them aware of the risk. You need to make them aware of the benefits. Okay? You need to make them aware of the risk and then you need to make them aware of the benefits. Ha? So hindi po pwede, for example, na nag-sign lang siya ng isang document wherein he is only aware of the benefits. Dapat they should also be aware of the risk. That's what you say informed decision. That's what you say informed decision. Okay? And once that decision class is informed, okay, respect that decision. Wag na po kayong makipaglaban, ha? Wag na po kayong makipaglaban. Okay, sometimes kasi yung nakakatuwa tingnan is that nurses are fighting for it whereas the family members already let it go. Okay, there are times na mas malakas pa yung iyak ng nurses than the family members. Okay, that's not it. That's not it. Okay, that's already too much and beyond your profession. Next, other than that, there are team and unit level concerns also. What do you mean, class, by team and unit level concerns? No? So poor communication. Okay, let's picture it, for example, that we are batchmates and then we work together in the hospital setting. Now, class, for example, if we are working as teammates, we are classmates, for example, since college, there might be a tendency that we are the ones who are having poor communication in the workplace. There is a tendency that we might be jealous with one another. There's also a tendency that we might not be listening to one another. Second, bullying. Okay, what's with bullying? Class, take note that one prerequisite for for your bullying, class, take note that one party needs to be stronger than the other. One party needs to be stronger with another. For example, if they would say, I'm bullying Jean, but then Jean could actually respond to me and then Jean could actually get a good fight with me, that's not bullying. It could only be bullying if, for example, I as a teacher is doing things that will be that would demean Jean, or for example, it would belittle Jean and then Jean would not have a fight on it. That's bullying. Now, class, bullying is very common in the workplace. There are instances that senior nurses, okay, do not respect the younger ones, and then their tendency is that they will be giving the younger ones hard time when it comes to their orientation. They're giving the younger ones hard time when it comes to their to the things that they do. So I hope that you will not be doing that and you will not be experiencing that. Next, working with incompetent colleagues. Now, class, if you are working with the incompetent colleagues, one thing that you need to do is to help them and educate them. Now, that's easier said than done. Because oftentimes, when you are doing this, the tendency also is that you get stressed along the way. Okay, you get stressed, and then class, that would again lead to your burnout. So that's why it's becoming a moral distress. And then witnessing practice errors. Now, let's say, for example, students, no, you are the nurse to another patient, and then you encounter nurse A. Nurse A is taking care of patient A, and you have noticed that she did something wrong on the medications. Okay, there was something wrong on the medications. what's the best thing that you would do? Tapos nalaman mo that nurse A has no plan of reporting it. What's the best thing that you would do? Will you just shut up and then keep it just like nurse A, or do you need to report it to somebody? What do you think?
Report it, sir.
Report it, sir.
Plus, dapat report. Okay? Report. The first thing, in fact, that you can do is approach first A first. Hey, nurse A, I've noticed that you've done a wrong medication. Let's report it. Okay? Make her report it. If she will not do it, the next thing is that you report it by yourself. Because you are always for the patients. Okay? You are always thinking for the patients. And when it comes to errors, guys, yes, it's an error. But the effect to your patient is actually less severe. The effect to your patient is actually less severe if you are able to report it right away. Compared that if you will delay it and then class later on, your patient would have consequences. Okay, and then lack of collegial collaboration, that would be equated to teamwork. That equates to your teamwork. So all of those equations make it difficult in the team to collaborate. Next, you also have system level factors. So class, when I talk about system, this already talks about the management and the administration. Okay, kindly write it down. This already talks about the management and then the administration. Okay? Now, what happens there, no? They feel unsupported. Okay? For example, during the time of pandemic, there are nurses who would complain that they could not feel the support of their heads. They could not feel that they are being supported during the time of the COVID-19. They could not feel that they have the emotional support that they were looking for. Okay, so that sometimes happens. Okay, and then that results plus to processes and constraints that that could impede the patient care delivery. So there are class instances, for example, the nurse committed an error. But at the end of the day, the nurse could not be blamed because the hospital where she is working was unable to provide adequate training. So later on, if you are already bosses, guys, take note that you need to train your people for them to deliver effective care to your patient. Or else that would lead towards moral distress on the part of your nurses. Okay? So I hope that you are able to capture those examples of moral distress that could possibly happen in our setting. So we will be continuing the discussion on this one on the succeeding meeting.